Good morning, colleagues. It's my pleasure to be joining you this morning as you explore and discuss the issues of post-COVID condition at this North American conference. My name is Sarah Viehbeck, and I am the Chief Science Officer and Vice President of Data, Surveillance, and Foresight at the Public Health Agency of Canada. I am joining you this morning virtually, and I really appreciate your attention as I do so. I know it's always hard to stay sort of clicked in during a recorded presentation, but I really hope that what I'm sharing with you from Canada is of use. I'm joining you from Ottawa, which is Canada's capital city. It is, though originally the unceded, unsurrendered traditional territory of the Algonquin Anishinaabe peoples. And the name for Ottawa was originally rooted from the word Adawe, which means to trade. That seems to be the origins of the word in the Algonquin language. I share that and offer that to you because I think that meetings like this one are really a place to exchange and trade ideas. And so it is in that spirit, with that traditional knowledge from First Nations people, that I join you today. I was recently in Boston and really enjoyed my visit. Would love actually to have been able to come back and see the city again and exchange with all of you in person. I'm sharing with you pictures that I took from the Boston Public Library, which absolutely took my breath away when I saw it for the first time just a couple of weeks ago. What really struck me about the library and libraries in general, it's not going to surprise you that I'm a reader, is that libraries are really intended to promote learning and pursuit of new knowledge, as well as create space for community. And I think that's really exactly what you're all together to do today, and what is really at the core of evidence-based public health practice. I am based at the Public Health Agency of Canada. The Public Health Agency of Canada is responsible for public health, emergency preparedness and response, infectious and chronic disease control and prevention. We do that at the federal level of government, and we do that in partnership with our provincial and territorial and Indigenous partners, as well as with communities across the country. In relation to the post-COVID condition, our agency has responsibilities for collaborating and coordinating to facilitate the development and implementation of post-COVID condition PCC interventions. This includes through engagement with research networks, as well as supporting guidelines development. We do surveillance work, and that's the main focus of my talk this morning. And we also look for opportunities to actually address the effects of post-COVID condition through existing and future projects, including through collaborations with provincial and territorial partners. As some, but probably not all of you will know, our health system is distributed across jurisdictions. The funding primarily comes from the federal government through transfer payments to provinces and territories, who are then responsible for really delivery of healthcare. You can see on the slide that my department, the Public Health Agency of Canada, sits along several other departments which report up to the Minister of Health federally, who represents that ministry in Parliament. Certainly, as all of you will know well, scientific knowledge of post-COVID condition is growing. We still have many unknowns, and that's part of why I'm glad that you're meeting today. It refers to the long-term effects of COVID-19 infection, occurs according to the World Health Organization when there are persistent symptoms experienced 12 or more weeks after the initial infection. Long COVID has become a more colloquial term for the condition, and it can affect folks across the life course. We know that avoiding infection is the best way of avoiding post-COVID condition. We also know that that's the case for fewer and fewer folks. We know that there are differential effects across individuals and across sex and gender. There have been reports of more than 200 symptoms being experienced by folks, and there are many studies emerging that really describe and articulate the symptomology, which vary in severity and can be cyclical, it seems. You'll hear that there are about 16% of Canadian adults which experience post-COVID condition after a confirmed or suspected infection. I'll talk a bit about that. We also know that there are a number of uncertainties, and that is why a scientific community around these issues is just so important. The underlying biological mechanisms need to be far better understood, as do the drivers behind why certain populations are at increased risks and what those risks look like across the life course, what the true long-term effects are of post-COVID condition, how we best manage and treat through clinical or other interventions the condition and set of symptoms, the extent of labor and economic impact of post-COVID condition within our country, as well as others, and now and in the future, and the broader indirect social impacts of those economic disruptions around things like housing and food security. Our response involves many players and actions. You see examples of the different departments and communities engaged and the kinds of actions that are taking place. And I'll talk through those a bit this morning to situate our activities. We established, under the leadership of our Chief Science Advisor, Dr. Mona Niemer, a task force that was really intended to build a framework for understanding and managing post-COVID condition. This multidisciplinary task force investigated and advised on how Canada should be thinking about post-COVID condition. I was a member of that task force and really pleased to be. The task force released its first report in December 2022. There were a number of recommendations falling out of that, which were put forward, and Dr. Niemer really prepared and drove that process on behalf of the task force members. We have also seen some investments, though modest compared to other countries, around funding to study the long-term impacts of post-COVID condition. We did see a $22 million investment made in research networks, and I know that we've got some representatives from those research networks here today. I thought it would be important to talk through the recommendations very briefly that came out of the task force's work, and talk also about which ones have had activity and actions associated with them, as well as ones that have yet to really be initiated. We saw a set of recommendations that were really focused around appropriate diagnoses of post-COVID condition and the need for clinical practice guidelines. That work is underway. We also saw recommendations around the importance of establishing research network. I'll speak about that in a moment, and advancing targeted priority research areas, including on the pathophysiology, therapeutics, prevention, clinical and translational approaches, along with socioeconomic interventions. The importance of having resources and tools available for people living with this condition. And I understand there are some in the audience today who I'm sure will offer their perspective, as well as that of their caregivers and dependents. The importance of communicating and collating links to be able to really create a kind of one-stop place for people to understand the condition better and the resources available. The importance of having a coordination structure, and I'll speak to the public health agency's role in that, and also the importance of data to drive decision-making. So those are the ones where we've got some activity happening, and I'll speak to in more detail. Our agency has driven progress on the recommendations, and what you see reflected here are some examples of the activities that have occurred. We've certainly been seized with ensuring that we have a good sense through our surveillance activities and large-scale surveys, which I'll speak to the results of in a moment, about what is going on in Canada with relation to post-COVID condition, prevalence, and impacts. We've established a secretariat within the agency to really help facilitate a whole of federal government approach and to be a focal point. I spoke about our work around population-based surveys, and I will in a moment. We've been emphasizing prevention through our vaccination efforts, although data are still certainly emerging around vaccination. We know that prevention of initial infection through vaccination or other means is important. We also are supporting the development of clinical practice guidelines and raising public awareness. Other government actions have also occurred. I want to acknowledge work and investments made by our colleagues at the Canadian Institutes of Health Research to fund a post-COVID condition research network, Long COVID Web. This multidisciplinary, multi-pillar network is really supporting the development of diagnostics, treatment, and rehabilitation for post-COVID condition. It's doing that in partnership with patients and those impacted. It's being led under the leadership of Dr. Angela Chung, who I believe is with you at this meeting. And so there's lots of good work coming out of that network, and we're pleased to be knowledge user partners in that network's activity in order to be able to mobilize that knowledge in real time. CIHR has also invested through its Center for Research on Pandemic Preparedness and Health Emergencies and other research investments to actually understand and help manage the condition. There's information available through our website and also through the website of others within the federal government family around benefits that may be available for those suffering from post-COVID condition. We've seen some adjustments made to our employment insurance benefits as well as disability benefits in order to help folks that are dealing with longer-term conditions. As I said a moment ago, part of our role is to engage in surveillance activities that seek to understand post-COVID condition, and I'm pleased to share some of those results with you. We did this in partnership with our colleagues at Statistics Canada, which is our national statistics organization here in Canada. And we conducted 3 waves of data collection through the Canadian COVID-19 Antibody and Health Survey. This is a cross-sectional population-based survey. It includes a representative sample of Canadians and is really important as a data source to understanding and addressing the long-term health impacts of COVID-19. The first cycle was done in November 2020 through April 2021, was really intended to learn about the virus, how it affects overall health, how it spreads, as well as whether Canadians are developing antibodies. We did dried blood spot samples and an electronic questionnaire. I will not be speaking to those results today. The subsequent 2 cycles were really more focused on post-COVID condition. Cycle 2, which you'll see results from in a moment, was developed to estimate the prevalence of post-COVID condition among adults in Canada and provide information on symptomology, risk and protective factors, and impacts on daily living. This was a sample of over 30,000 respondents and through electronic questionnaire. We then did a follow-up questionnaire between May and June of last year, where we collected new and updated information about health from almost 10,500 respondents who completed cycle 2. The questionnaires for cycle 2 and the follow-up asked about new or continuing symptoms of COVID-19 3 or more months after a confirmed or suspected case of COVID-19. So key findings from cycle 2, and these have been translated into Canadian level estimates of the adults who experienced longer-term COVID-19 symptoms. So that subset that had actually experienced symptoms lasting 3 or more months. 47.3% experienced symptoms for a year or longer. 21.3% said their symptoms often or always limited their daily activities. 44.7% of adults who were hospitalized for COVID-19 reported longer-term symptoms compared to 2.3% of adults with no initial symptoms. This tells us that some folks are experiencing symptoms for a longer period of time, that these symptoms are interrupting their lives in a not insignificant way. And that means that it could impact their daily activities, their work contributions, their productivity, and that we see a relationship around severity of COVID-19 with outcomes. And these findings, I think, are quite consistent with what we've seen from other studies. We see differences according to a number of key characteristics, including those with mid to upper range obesity being more likely to report long-term symptoms, women more so than men, those that suffer from multiple other chronic conditions more likely than those with none at all, and those that have not been vaccinated at all are more likely to experience those symptoms. When we did the follow-up, which was done last year at about this time, we found that nearly 20% of infected adults, which translates to 3.5 million Canadians, have experienced long-term symptoms following a SARS-CoV-2 infection. The symptomology that we see reflected primarily were most commonly included fatigue, brain fog, and shortness of breath, consistent with global studies of symptomology. Adults reporting long-term symptoms more than doubled from 14.6% for those that had experienced a single SARS-CoV-2 infection to 37.9% for those that had had multiple infections. Keeping in mind that the data were collected in 2023, and so folks are more likely to have been experiencing multiple infections. Just over 2 million Canadians are continuing to experience long-term symptoms. 100,000 adults have been unable to return to work or school as a result of those symptoms, according to their self-assessment, and 46.9% of Canadian adults who have experienced long-term symptoms were seeking information and had consulted healthcare providers about those symptoms. As I said, of that 52% of adults reporting PCC continued to experience it. This translated to many Canadians, over 2 million people, which was the estimate from the representative survey. So we need to help. We need to help Canadians that are experiencing and suffering from this condition. And one way to do that is by supporting improvements in clinical practice to support management of these symptoms over time. We've made an investment to support Cochrane Canada and related guideline development centers at McMaster University in developing evidence-based clinical practice guidelines. And this is through a group that was created for this purpose. The guidelines will be published in the year ahead, and they will span from prevention through to identification, assessment, management, and follow-up of people with post-COVID condition. And there will also be tools that are supportive of their implementation with special attention to equity-deserving populations. So the three components of this initiative include the development of 6 comprehensive evidence-based guidelines, extensive knowledge mobilization activity to support guideline uptake in clinical practice, and also a mechanism to ensure that we've got guideline effectiveness maximized through impact evaluation and quality improvement. We know that we need to continue to build evidence and address data gaps. We will continue within our mandate to share and mobilize knowledge through our surveillance and coordination activities. We are paying particular attention to identifying the factors associated with symptom duration and severity among that significant proportion of Canadian adults reporting longer-term symptoms and chronic conditions. Assessing other potential data sources, including how we can leverage existing surveillance system in provinces and territories to understand this picture and the variability of this picture over across our country. And we will continue to support research initiatives and collaborate with research initiatives to advance our modeling techniques to resolve the gaps in data sources and predict the socioeconomic impacts, as well as to propose cost-saving interventions that can also help Canadians as they manage this condition. I'll just like to acknowledge colleagues from across the agency that have helped contribute to this work and presentation. The data that I presented to you were supported by the Public Health Agency of Canada, but collected through our colleagues at Statistics Canada, and the reports are available publicly online. Thank you very much and enjoy the rest of your conference.